Anand, can you ask her? I don't think so. I'm online because nothing is coming. Can you check with her? Sorry, everybody, for the technical glitch. Not sure what happened, but I'll take it up from here. And I'm going to start with what we have covered in the previous slides, and then I will take it up from. So I mentioned in my previous video, I just mentioned about what all occupations I'm going to cover, which is mainly about all kind of laboratory technicians or the scientists, then the pharmacists, then the nurses, and biotechnologists and all that. Okay. One by one, I'll take up all the skills assessment bodies and their requirements, what their requirements are. The first skill assessment body that I'm going to cover is an ANMAC skills assessment. ANMAC is a skills assessment body for the nurses. And to get their registration, the most important thing is that you have to get an AFRA registration. AFRA registration, you get it on the basis of either you have studied an accredited course from Australia, or you have done a bridging program or a conversion program. If not, if you have not done it through the study, then you can give the exams, which are the MCQ and the clinical test exams called as NCLEX. And once you clear those exams, you get the registration to work as a nurse in Australia. Based on these registrations, then you can apply. Once you have the registration, then only you can apply for an ANMAC skills assessment. 7 each in English is also compulsory. The requirement of having any work experience is not required to apply for a nurse's skills assessment. The main thing about it is a registration, and to get the registration is a master's study, bachelor study of Australia, doing a conversion program or a bridging program, they are called as both, or clearing the exams in an for NCLEX. If you have done that, you will get the assessment done, you will get the registration, and the registration will lead you towards an assessment. 7 in English is also mandatory, which is even required for your registration also. So registration is the major part in an ANMAC skills assessment. Then after that, we talk about the medical laboratory scientist and a medical laboratory technician. These both are the AIMS skills assessment. We call it as an AIMS. Applicant needs to study and complete the accredited qualification. Otherwise, they have to sit for the AIMS exam and get minimum 7 in English. That's the minimum requirement. So the accredited qualifications, if you have those ones, no exams are required. And the other one is the medical laboratory technician. Their requirement is minimum the diploma study. However, the scientist is the minimum is the bachelor study. And the technician requires the 2 years experience in the laboratory within the last 5 years. So if your experience is beyond the 5 years, then you cannot apply for a medical laboratory technician. For the medical laboratory scientist, the acceptable science degrees are minimum 2 years of a diagnostic medical pathology laboratory work experience is required within the last 5 years. If not, then your primary qualification must be as a Bachelor of Medical Laboratory Science, Masters of Medical Laboratory Science, Biomedical Science and a Laboratory Medicine, or Masters of Laboratory Medicine, or Masters of Clinical Pathology. A lot of people are not aware that the clinical pathology would also lead you towards the medical laboratory scientist. These are minimum the 4 years degree, and they are accredited by AIMS. Not all the universities in Australia have got these ones as an accredited. If your degree is non-accredited, you have to clear the test and need to have a 2 years of a full-time experience in the laboratory to be eligible for a scientist. So it is highly recommended that in case you are looking forward for your skills assessments as a medical laboratory scientist and you're going to go towards study, then make sure that your degree is accredited. The list of accreditation is there on the AIMS website. We can see which all bachelors and masters are accredited. There are very few, there are about 7 to 8 programs, including the bachelor's and the master's degree. So you must ensure that it is an accredited. Otherwise, the 2 years of an experience would be required. Now we talk about the medical laboratory technician. Their requirement, their minimum requirement is the diploma completed in a medical laboratory science. And then you need to have a 2 years of an experience as a medical pathology laboratory. So the ones who are working in a pathology, where we take the blood samples and a specific pathology laboratory, that is required for a medical laboratory technician. AIMS does not require you to do the professional examinations for medical laboratory technician. And even sometimes when your medical laboratory scientist application is unsuccessful, they would ask you to go with a medical laboratory technician uh, work experience. They may do that because now the difference between major, you could see the laboratory scientist also needs a 2 years of an experience. Medical laboratory technician would also need it unless until our degree is accredited. And sometimes when we apply for a medical laboratory scientist, they would say your experience is not in the pathology as a diagnostic. Your experience is more towards a technician, and then they guide you to go towards a technician. Or even if you fail your exams, which you have sit for, then also they guide you to go towards a medical technician. Okay. So AIMS professional exams, if you fail, then also and then the 2 years experience of your scientist will be counted towards the medical laboratory technician. Now we talk about the wet assess skills assessment. Okay. Now wet assess skills assessment would cover your industrial pharmacist, pharmacy technician, biotechnologist, microbiologist, and all of these ones will take you, or a medical technician's NEC. Okay. So wet assess requirement comes as a general occupation. They would need an applicant to have a highly relevant degree in their nominated occupation. For example, I've done a diploma in pharmacy, and then I would need a 1 year experience post qualification to be eligible for a pharmacy technician. Pharmacy technician does not need a degree to be assessed. It only needs, and that experience can be Australian, that experience can be overseas. It has to be 1 year experience within last 5 years after completion of your degree. Just in case you have got the experience while doing your qualification, then in few circumstances it is accepted, but not in all. And that is case by case basis. So right now, I will only talk about the normal or the most popular scenarios where the veterans would need a 1 year degree, 1 year experience post qualification when you have finished your highly relevant degree. The degree can be from Australia. The degree can be from overseas. There is no accredited pathway from wet assess. So for a wet assess, even if you have done an Australian qualification, you would still need a 1 year experience to go ahead with your skills assessment. Wet assess does not have an accredited pathway. Industrial pharmacist, applicant needs to have minimum a bachelor qualification, which is major in pharmaceutical, and 1 year experience in last 5 years. So if I am a pharmacist and I do not have an experience, or I'm not able to get my skills, not the skills, exams cleared for a pharmacy, which is the APC, but I have worked in the industrial of the pharmacies where all the pharmaceutical companies are there, and then you're working into the policies and procedures as an industrial pharmacist, then you do not need to have a registration. We can apply for an industrial pharmacist skills assessment on the basis of 1 year experience within the last 5 years, whether the qualification is from Australia or overseas, and you can get your skills assessment. As I said, skills assessment is a major key further to apply for any permanent residency. Then comes a pharmacy technician. Let's say you have done a diploma in pharmacy but not a degree, then we can and have a 1 year experience working under a pharmacist for 1 year, then you can apply for VETSS skills assessment. Biotechnologist, microbiologist, their qualification must be highly relevant, and again, a 1 year experience. So for a VETSS, whenever you see your occupation and you see your assessment body is a VETSS, then the key fundamental of a VETSS is 1 year experience. Australian qualification, non-Australian qualification, overseas, here, doesn't matter. It just leads to a 1 year experience would lead you post-qualification, would lead you towards a full skill assessment. Now we talk about in pharmacy council skills assessment, where it is about the pharmacist, not the industrial. So international student, there are mainly the two streams in it. One is international student stream, and another one is a knowledge stream. So international student stream are the graduates from Australia or New Zealand. Once you have got completed the study into this one, then you do not need to have any experience or sit for an exam. You can straight away go for the skills assessment from the APC. However, if you have got a knowledge stream, you are graduated from other countries, you need to sit for a CAPS exam, KAPS exam. And for the CAPS exam, it's in the 2 stages that you have to complete. And once you complete your exams, then only you can get a full skills assessment required for the migration purposes. The next skills assessment body is the Psychological Society of Skills Assessment. So that's a PSA. This is for the psychologist. So you must have completed minimum 6 years of a qualification in Australia or even in overseas also to get at least start your assessment requirement. 6 years of qualification would be underlying bachelor's degree for 4 years and then leading to a master's degree for 2 years. If you do not have the 4 years degree in psychology, so if let's say I've done bachelor's in social work leading and with the psychology as my major, it would not be accepted. Your underlying degree needs to be completely, fully towards the psychology. If it is not, then there is no accredited pathway for this one. Getting a psychological skills assessment as a psychologist, it's not easy to go on to those ones because mainly the overseas degree that we have done from bachelor's degree are for 3 years, not for 4 years, and hence it does not lead to the 6 years of a requirement. After that, we talk about the psychotherapist. Psychotherapist Council of Skills Assessment is the assessment body. You need a qualification completed in Australia, that is in the board's approved programs of study list. So they have got a qualification for which they instead of accredited called it as a board's approved program. If you do not have that your study is in that list, then your sorry about that. A council is going to issue a certificate of substantial equivalence after successfully completing the equivalence of examination pathway. Then you have to sit for an exam, and then the council is going to issue the certificate. And then this certificate will lead you towards the general registration with the Psychology Board of Australia. The degree from the Australia as well as the New Zealand, both are considered are in the psychology board. So if you have done those degrees under the approved exams, you do not need to sit for an exam. Skills assessment requirement for an English is still the same, which is 7. And that's majorly for all of the assessment bodies that their requirement is. Sometimes we have done we have got a multiple skills assessment also. People do say that they have done their bachelor's or a diploma in the pharmacy, but here they are doing a bachelor's in nursing, and back home they have done a 1 year experience. Then I would say always go with the multiple skills assessment, because if you can, if you are eligible or can get those ones, it will spring your requirement of getting the permanent residency, because the more you have skills assessment, of course that leads towards it. Also, I would be taking the all the questions that you have it, and please let me know and keep writing it here, which I will take it in the end to all your questions. And now let's say that as I have talked about all of these assessment requirements, majorly their requirements are either you need to have an accredited qualification or with a registration, or you have to go with the exams. Once the skills assessment are done, what next? Then you have got three visa categories to choose from, which is basically called as a general skilled migration. These categories are mainly into visas of 189, 190, and a 491. So 189, major occupations related to health at the minimum lower points of the 65. People are getting all the invitations for a 189. Though the 189 rounds do not happen very quickly. They do happen once in every 3 months or 4 months. But once the department does invite them, they invite them for at the minimum lower points of as low as 65, which is great. So getting a skills assessment, if you, let's say you are within the range of 30, less than 32 years of an age, you have got your 30 points for that, 15 points for your occupation, 10 for your English, 30, 40, 45, 55, you have already got it, and 10 for your Australian study. You're sitting at 65 points easily. If you have not studied in Australia, then maybe you are single, you get 10 points for that. Again, you are meeting your 65 points. Again, let's say that you did not study in Australia, you do not have skills, you are not even single also. Then in that case, you can cover your 10 points either by sitting for an 8 in English, or can go with a 190 visa, where the state will give you 5 additional points, and then you can apply for your visa based on the 190. So 65 points is the base. Either you get it in a 189 by having an English, being single, or doing an Australian study if you're married, or different ways that we can get to say 65 points. Once you get a 65, rest assured you will get an invitation from the department. If not, then 190, where the states are giving them the invitations. Every state has got their own requirements. I'm not going into the details of the state requirements, because we will have a separate seminar about what are the different requirements of every state, or we will do a live sessions also about it. Then stay tuned for those live sessions, and you can get to know about what is the requirement of each state. And even these skills assessment can lead you towards a 491 relative sponsored also. So let's say that you are of a age of more than 30, so you are losing some points over there, but you have got a relative living in a designated area of Australia. They can give you 15 points. Those relatives it can only be your brother, sister, your first cousin, your auntie, or your uncle. So any one of those ones, if living in designated Australia, then they can give you the 15 points. The designated Australia is the whole Australia except Melbourne, Sydney, and Brisbane metropolitan. So if your relatives are living in any of these states, then unfortunately they cannot give you the 15 points for 491 relative sponsorship. Lots of people come and they say, my sister is here and we want to apply for the 491 visa. The skills assessment requirement, the points test table, the English test, exactly, everything is there. It's just that you can give them the 15 points if you are living in designated area, and your occupation needs to be in a long-term list. Lots of majorly the healthcare occupations are in the long-term list, except few of the pharmacy ones and the enrolled nurse. So in those occupations, you cannot give the points to your relatives. And That's majorly about all the skills assessment requirements and all of those ones. If you have got any questions, can you please write it in the chat box and I will take it up from there. And let me see if there's any question here at the moment. We've got one from Bilal Gujjar, and he says, "Hi, ma'am, hope you're doing well. If I do the civil construction diploma on fast track from Perth and have 8 each plus NATI, what are my chances for 491 and 190?" Okay, this is completely different from the off track, but I'll give you, yes. So let's say that you do a civil construction diploma, which is an advanced diploma. You do not have to do a diploma. It has to be an advanced diploma. Then you can get a skills assessment from Engineers Australia, and this is considered as an accredited study. After doing an accredited study in Australia, and if you have 65 points, then definitely 189 were invited at as low as 65. Plus, all the states are also open for civil draftsperson, civil engineering draftsperson, because this is what it will lead you to. And that will give you a good edge of getting a state nomination or an invitation from the federal government. Okay. I guess these are the questions that we have at the moment. Thank you so much, everyone, for listening. And if you have got any more queries, please contact us and we'll get back to you. Thank you.